Hi, my name is Melanie, and I am your IVF nurse, and welcome to today's topic of conversation. So today we're going to be talking about common fertility terms that you may hear within the clinic with your healthcare providers, or that you may possibly be reading online with any fertility websites or blogs when you're doing your research. So to start, in the fertility clinic you will hear common terms of ART, which is assisted reproductive technology. When you're speaking with your RE, your reproductive endocrinologist, they may use terms such as SA, which is a semen analysis, and this is done for men, and it can assess for things like motility in the sperm, so the ability for the sperm to move on its own. It's also going to look at morphology, so the shape and size of the sperm. It's going to assess if there is sperm in the sample. So if there is no sperm in the sample, that is referred to azoospermia. And then agglutination is when the sperm clumps together. So with a semen analysis, what the doctor is looking for is male factor infertility. And this is a common issue as well. It's not always the women. Now, with the women's testing and the things that they look for, so for some of the common terms that we use when we're doing blood work, you will hear us write E2, which is when we're checking your estrogen. P4 is referred to as progesterone. The LH is the luteinizing hormone. The FSH is the follicle stimulating hormone, and this is the hormone that comes from the pituitary gland and causes the follicles in the ovary to grow. Now, some women need a little boost of this, so this is medication that can be purchased in terms of called Follistim, which is Puragon in Canada, or even the Gonal-F, which is also something that can, or a product that can promote the follicles to grow, because they do have FSH in them. Now, with other things that you'll hear us use is the HCG, which is the human chorionic gonadotropin, and this is usually referred to as the trigger shot. It is also the same thing that your body produces when it is pregnant, so it's very similar in terms of if you're doing a pregnancy test after you take a trigger injection, your test will show up positive, but however, it'll be a false positive at that time, as it can take anywhere from 7 to 10 days for your body to metabolize the HCG once you've had a trigger shot. And the trigger shot would be the literal HCG, can also be called Pregno, and some women will use Ovidrel as their trigger injection. With regards to the endometrium, we are looking to see that the endolining is about 7 millimeters or thicker at the time of ovulation or at the time of embryo transfer. Now, some other common terms that the physician is going to be using are things like amenorrhea, so this is when you do not have menstrual periods, and ovulation, which is where women do not ovulate or may not ovulate regularly. IUI is an intrauterine insemination. ICI is an intracervical insemination. A TDI is a therapeutic donor insemination, and this is where you're using donor sperm. When your physician recommends that IVF, in vitro fertilization, is the next option for you, or an option that is going to be more successful for your outcome, you will start to begin to hear terminology such as ICSI, which we call ICSI, and this is intracytoplasmic sperm injection, AH, which is assisted hatching. When you're approaching your egg retrieval, which eggs are also known as oocytes, what's going to happen is that when they put the sperm and the egg together, you will start to get updates regarding the fertilization. So 2PN is 2 polar nuclei, which is representative of a normal fertilized egg and sperm once they have met. With regards to development of the embryo, you may hear terminology such as a zygote, a day 3 embryo, day 5 embryo, or an early blast, which can be a morula, These are all things that you may hear if you're speaking with the embryologist or whichever healthcare provider is providing you the information about your embryos. Now, if embryos are frozen, then that is referred to as a frozen embryo transfer, so an FET. And then a lot of the times they're also referring to a single embryo transfer, which is an SET. Now, some of the common terms that you may find while doing your research, and these are commonly found on blogs or fertility posts, are things like AF, which is referred to as ant flow. BFN is big fat negative. BFP is big fat positive. And those are in regards to fertility tests or pregnancy tests. The DH, if you're ever hearing about that, is referred to as the darling husband. CD is your cycle day, so whether you're cycle day 1 or cycle day 10. CM is your cervical mucus. DPT is days post transfer. So many times you'll see 3 DPT or 7 DPT, and this was referred to as when the embryos are transferred into the uterus. Now, if you're doing insemination or timed intercourse cycles, then you may be seeing some like abbreviations of DPO, which is days post ovulation. HPT is home pregnancy test, and that's the urine test that you can take at home, and that's usually recommended to follow the instructions on the box for accurate results. LMP is your last menstrual period. OPK is ovulation predictor kit. POAS is pee on a stick, and TTC is something that we're all seeing very much of on the internet, and that is trying to conceive. So this concludes my little talk for today. Please remember that if you would like for me to talk about anything in particular, you can reach me at yourivfnurse@gmail.com. Please visit my website, www.yourivfnurse.com, for more information about my services. Thanks for watching.